I'm John Beadle, co-founder and managing partner of Aegis Ventures. Welcome to Consortium Conversations, where we introduce you to the health system leaders at the forefront of health tech innovation. Combined, our digital consortium partners deliver care to tens of millions of people annually and serve as a critical implementation sandbox for new technologies with the potential to dramatically improve the experience of healthcare for patients and caregivers. These are the frontline stories of the innovators whose decisions impact countless American lives every single day. I'm John Beadle, co-founder and managing partner of Aegis Ventures. This is Consortium Conversations. I'm delighted to be joined today by Michael Dowling, President and CEO of Northwell Health. Always great to be with you, Michael.
Thank you for being here, John. It's a pleasure. Looking forward to a nice discussion.
So let's start with what you've been able to achieve at Northwell over the last 25 plus years. It's really been amazing to see you take it from a single hospital on Long Island to the largest integrated delivery system in the state, the largest private employer. One of the statistics that always blows my mind is 1% of all of America's babies are born in one of your hospitals. As you look back at that legacy and everything you've been able to achieve, what have been the consequential decisions that have led to Northwell's success, and what are you most proud of as you look at the system today?
Well, this is going to take an hour to answer that. And I've been very, very fortunate. I've had an interesting background because I spent quite a bit of time in government, which gave me the opportunity to look at healthcare from a very broad perspective and see, what might be possible. I've been in the insurance business, so I get that kind of a perspective, and I've been on the academic side of things, so you get that perspective. So when I came to North Shore way back, there were no health systems at all in this part of the country. There was none in New York. So you think about, what are the possibilities? What can you do? The last thing you ever want to be doing on anything is playing yesterday's game and protecting the status quo about what things were like before and repeating it. You want to think about what you should be doing completely differently in the future. And I was very, very familiar with what was happening in the western part of the United States, with places which you're familiar with, John, places like Kaiser Permanente, Intermountain in Utah. And I understood that what needed to happen over time was the building of a large integrated health system. Even though the definition of what that was at the time was unclear. Now, other people at North Shore Hospital back then were thinking about the same thing. So when I got here, there were discussions going on about that possibility. So you start building and you decide to take risk, and you get hospitals to join together. And then you realize after a while that it's not just all about hospitals, it's about outpatient ambulatory. Then you realize it's just not about hospitals and ambulatory, it's about long-term care, and it's about home care. And it's about contemplating, what is the world going to look like in the future? And what are the kids looking for? If you look at 20-year-olds and ask the question, how do they expect care to be delivered in the future as they evolve and age? And you had to do it differently. Then how do you put all of those pieces together? Because you can build blocks, right? But building individual silos and pretending that they all work together is one thing, but then you got to make them work together. And you want to be able to create the future. You operate today. Management is about, leadership is about, forgetting the past, managing the present, and creating the future. So I always had this idea about you've got to do the first two, but then you really got to create the future. And we've evolved into something that is very, very large. Nobody ever thought we could do it, which, by the way, is wonderful. When people think you can't do something, it's a wonderful motivator. When people tell you can't do it, that's even a bigger motivator. And then we, obviously start, we want to do partnerships, we want to be creative, we want to be innovative. Not everything you do is a winner. And we end up today, as you just said, John, being the largest player in the region and the largest employer, but that's not good enough. You've got to be the best. And you've got to be the best at service, quality, innovation, creativity, and wherever. Today, now, we've got to be thinking about where do we want to be 15, 20 years from now. The worst thing in the world is to think that you're good. No matter what you build, it's to believe that now I have succeeded, therefore I can relax. When you get really good at anything is when you got to put the foot on the accelerator even more, because you always got to get better, because now we have a lot of competition. It didn't exist before in the same way as it does today. So it's been a terrific journey and exciting, and you get good people around you. You give people the ability to be innovative and do new things. You give them the freedom to make mistakes. You create a positive culture where everybody wants to work together, where employees want to belong to something rather than work for something. You put that whole menu, that whole gestalt together, and if you're lucky, it comes out the other end looking pretty good. So we've been pretty fortunate, but we're only at the beginning of what we can achieve. We're not at the end of anything, we're at the beginning of everything.
Let's stick with what you said on culture for a moment. Right. So as I've met with a lot of different health system CEOs that have grown via M&A in the way that Northwell has, a lot of them have struggled to coherently integrate all of those new assets, but I think it's something you've been extraordinarily successful at. What do you think it is about the Northwell culture that's enabled you to bring in such large organizations and be able to create one cohesive culture where you prioritize that continuous innovation you mentioned?
Promote and expand the opportunity for good people to do great things, and don't tolerate those who do the opposite. It's a phrase I use with employees a lot. Ever so often you got to weed the garden. Now, when you start out doing things, you got to weed it a lot. If you keep doing it slowly, then all of a sudden you grow wonderful vegetation, right? It's the same with organizations. Don't tolerate bad behavior. Don't tolerate people who don't want to be part of a team. Get people around at every level of the organization who want to do the right thing all the time, so you don't have to worry about them. If you have any leadership working for you where you got to worry about what their motivations are, they're not the people on the team that you should have. And you promote very simple concepts, things like that we long for all the time: a sense of decency, honesty, integrity, trust. Progress moves at the speed of trust. If you and I trust each other, we'll get stuff done. If I don't trust you, we don't get anything done if you don't trust me. And it's all relationship building, but it takes a lot of time. All the time you've got to be doing it, building relationships. And this is even in today's world of technology, and I know we're probably going to get to the technology side of things, but technology is wonderful, it's phenomenal, but it should never replace the personal relationships, because it replaces the personal relationships, you've lost something special. So it takes time, and it takes face-to-face like this. So that's something that you've got to keep building on, and we haven't got it right yet, because I don't believe you ever get anything completely right. You're always making it better. For sure. And our motto here is to be the best and getting better all the time.
Something you mentioned, Michael, is that you're always thinking about where the puck is heading 10, 15 years from now and trying to get your teams to skate towards it. And I've seen that in the 5 years that we've been working together. In the last 18 months in particular, partnerships like the ones we've created have become a big focus for every healthcare system. You were thinking about this 6, 7 years ago, and everyone in the industry looks to you for that inspiration and guidance. And
I'm not so sure that's true.
Well, everyone I talk to.
Yeah, you almost talk to more people, then you'll get a different point of view.
But I think everyone looks to you for that guidance on where things are going, and you're unafraid to be first. And when we started working together, this was very unknown. Yeah. There was a lot of risk associated with it, but I think you really believed in this new paradigm of collaborative innovation, of bringing health systems together to be able to solve common problems.
Well, to move ahead, you've got to walk into the unknown all the time.
For sure.
Like we're all immigrants. I came here by myself. I was young. I came to New York. Did I know what was going to be happening the following week? Not really, but I knew I'd figured it out. So you've got to join in partnerships, you've got to work with people, and you've got to move forward. If it doesn't work, you change it, or you move in a different direction. We're always at a crossroads, So you can go backwards, you can go sideways, you can go left, right, or you can go forward. So you keep going forward and developing the right partnerships. And I remember when initial discussion about Aegis, people were thinking, Who are they? Can you trust them? What are you going to be doing together? And my attitude was, yeah, I believe I can trust. And what exactly we're going to be doing together, I'm not so sure. But I know together we'll do more than we would do separately. So let's go and figure it out. You don't have to have all the answers up front. You have to have the willingness to move into a new arena and just try something. And that's what innovation is all about. It's pursuing the unknown.
Even as we've been able to partner with different groups inside of Northwell,
Yeah.
you've been so extraordinary at championing this from the top down. Everyone on the executive team throughout the organization knows that this is something that you want to prioritize. The bottoms up support has been critical to Garner as well.
Because it's a team.
It's all a team.
But you guys as partners have been absolutely terrific. Much more creative than I even thought at the beginning. I mean, we took gambles on one another. But life is a gamble. You get up in the morning, you get in your car, it's a gamble. You get on the LI, you get on traffic, it's a gamble. And there's no guarantees on anything, and I don't believe in the idea of entitlement for anything anyway. I didn't, there was those people like Rich Mullery that met the people that created Aegis. Then he comes up to me and he said, you want to have dinner? Sure. You want to have lunch? Sure. Had lunch, we had dinner, we got together, thinking, who the hell are these people? This is weird. Well, it's weird enough to give it a chance to figure out, because, if you really want to innovate, you've got to be a little bit weird. You've got to be a little bit off. You've got to be a little bit non-traditional. You got to kind of fly into the unknown, as I said earlier. So those are the people I enjoy. So I said, okay, let's go. And it gets created. I didn't create it.
You played a huge role in creating it. I never would have been around without you, Michael.
Right, but you guys created it. But this is the true whatever. Create an environment where good people have the freedom to discover.
And I think the secret to that point, Michael, is we've built complementary skill sets and complementary resources. You haven't tried to replicate skill sets or capabilities we have, and vice versa. And I think the two teams have really grown together, and we've created this great blueprint that we're now bringing to health systems all across the country.
Well, I'm big into sports, right? So I played very competitive sports, and I was on championship winning teams. And I look at everything as I use sports analogies a lot. So I was a forward, and I was a center fielder and a forward. I had a specific role, but I had to depend upon my defenseman. And ever so often I played defense, but I wasn't a defenseman. But if I didn't have a defense person, a partner, I didn't have to have all his and her skills. I had to appreciate them though, and work with them, and compensate for them, and appreciate it, and appreciate the roles of each. And you all learn a piece of everybody's business, but you don't replicate it. I don't become you, you don't become me. But I kind of mine your talents for the initiative, you mine our talents for the initiative, and when everybody's free to do that, you create an initiative that wins. So this has been, a pleasurable experience working with Aegis over the years. How many years has it been now?
5 years almost.
5 years. Time goes fast.
It does.
Yeah, you look younger though. I mean, you're touching it up a
You're
little bit.
You're looking pretty good yourself, Michael.
Well, I'm glad you look. When I look in the mirror, I look a little bit different than I did years ago. But 5 years, and just imagine what has occurred. We've started quite a number of companies, whole new series of endeavors. We're now engaging with another half dozen or so other big health systems, trying to entice the latent talent that is there, as long as there is a common mission and a common focus, and there is some resilience, and people want to do something new and different. It just is absolutely, it's kind of wonderful. And I've learned. I know a lot more today than I did when I started. When we started, I didn't know what I was doing.
We all do, right?
Look, you learn when you start doing something, you have no clue what you're doing. If you know everything up front, you're not going to do it. So you try something, and in the process you learn. And then you let things evolve. And if Rich Mullery, you guys come in and we say we tried something and it didn't work, fine. That's good.